Hi, this video is an example of the FUT strip harvesting scar. I try to provide as much example as I can. Again, results vary from one individual to another. Some of them could be smaller than this, and some of them can stretch bigger. It's very hard for us to predict. However, we can, in general, notice that with the first surgery, the scar tend to be better, but each subsequent surgery it can expand larger. Why? Is because that's how scar is. Each time more injury, your body say, oh, we didn't produce enough scar to protect our skin, and that's why it got cut open again. So we need to make a stronger scar, a thicker scar, to make sure that we don't get it, injured again. Again, that's a trend, but it doesn't mean it will be big the second time or the third time. But it varies. Again, we see the trend that multiple surgery can have a little bigger scar, or genetic based. On one spectrum, African American tend to produce bigger scar than Caucasian. And then in the middle, so Caucasian is genetically produce the smaller scar. That's in general. And then some in between is Asian and Hispanic. Again, I do perform both FUE and FUT, and both of them provide good result. Both of them produce scar. The FUT, or the strip method, is not just a linear scar. It's more invasive than FUE, more painful during recovery, and it's a little bit longer healing. But again, it's just 1 or 2 days. But the good side of the strip method it's a lot cheaper than FUE. You can move a larger number of grafts per day. We can start at 35, but it can go up to 5,000. So it's better for advanced hair loss with the strip method. Where the FUE is more for mild to moderate, because FUE tend to be 2,250 grafts to up to 3,000. Okay. The strip method, when you compare my FUE to my strip tend to have 5 to 10% better density. But then they both will give you good result. I can produce excellent result and density whether you do FUE or FUT. But if you compare my FUE to my FUT, the FUE tend to be 5 to 10% less. It could be 20, depend. But even my FUE is less, it's still better than a lot of clinic does strip or FUE. On the other hand, the FUE has tiny dots of scar, less invasive, less painful during recovery, faster healing. But the downside of the FUE it's a lot more expensive, it's more labor. The number of grafts we can do is less. We start out at 2,250 grafts, and it can go up to 25 to 3,000 grafts. And so it's better for mild to moderate hair loss. It can be used for advanced, but you're going to need multiple surgery. The other benefit, the other downside of the FUE are the growth rate. Now, and again, my FUE and my strip, I will produce excellent density and excellent result. However, if you compare my FUE to my FUT or the strip method, it's 5 to 10% in general less than the FUT. But it's still better than most clinic does FUE or FUT. The other thing about the FUE is we have more aggressive shaving, so we shave all on the back for the donor area. So this is the demonstration of the FUT strip method linear scar. Again, the result varies from one individual to another. Bye-bye.